Hey guys, if you are starting Invisalign, this is the video that you're going to want to watch. Everything you need to know, the tips, the hacks, all just basic instructions. This is what you need to be successful. So the first tip is you have to wear your aligners at least 20 to 22 hours a day. If you don't wear it, it won't work. In fact, if there's certain times where you're not wearing your aligners, your teeth actually might regress and go back to their original positions. Next, you need to use chewies. Most orthodontists will give these to you, but if they don't, you can order them on Amazon. What chewies are designed to do is to make sure your aligners are seated all the way in your mouth. So the common area that the aligners don't get seated is in the front. So you need to use the chewies across the front 6 teeth. And what I would recommend is that you chew and bite into each tooth every time you seat your aligner. Next tip, if you go on vacation, bring more than one set of aligners. What sometimes happens is you'll lose your aligners on vacation, whether you're at a restaurant or at a hotel. If you don't have anything in your mouth for a long enough period of time, your teeth actually start regressing and going back to their original positions. So I always suggest having a backup, meaning you're either your next set or your previous set. Next, don't drink anything with sugar while you have your aligners in your mouth. The reason for this is because the sugar actually will get trapped underneath the aligners, and now that your tongue can't cleanse your teeth naturally because you have plastic over the tops of them, it will increase your risk for cavities. So anytime you drink anything with sugar in it, the aligners should be out, and you should wash your mouth out or give your teeth a quick brush before putting your aligners back in. Another tip is with food. So after you eat food, you should always clean your teeth before putting your aligners back in. If food gets trapped on a tooth, and then your aligners get seated over the top of it, it's holding the food against your tooth. Bacteria will eat that food up and create cavities on the tooth over time. So always make sure that you brush your teeth after eating, or at least wash your mouth out with some water before putting your aligners back in. Another thing you should know is that there are attachments on some of your teeth. What these are tooth-colored bumps that create handles on the teeth so that we can move your teeth more efficiently and effectively during your time in aligners. Personally, what I tell my patients is if one of these attachments falls off between visits, I'm okay with that. Just let me know at the next visit and I'll let you know if we need to put it back on. Now, if all of the attachments start falling off, please call the office so I can take a look. Another thing to expect during your Invisalign treatment is something called IPR, or interproximal reduction. What this is we go and polish between certain teeth, and there are several reasons why we do this. One could be that you don't have enough room for all the teeth, so this will help create space for them to fit. Another is called a black triangle, usually due to a triangular shaped tooth where the gums don't fill in, and although the teeth are touching, it looks like a space. What's interesting is these are super common in adult patients, and you don't always see them when the teeth are crowded because the teeth are overlapped. But as the teeth become straight, you'll start to see those black triangles form because now the teeth are side by side. And the only way to get rid of a black triangle would be to go reshape between the teeth. That creates a small space so that it allows the teeth to be pushed together, getting rid of the black triangle. A third reason why you might need IPR is because the bite doesn't fit properly. So sometimes in cases where the upper teeth stick out too far from the lower teeth, we'll do some IPR in the upper teeth to bring them back. And then same, if the lower teeth are out too far from the upper teeth, or what's called an underbite, sometimes we'll do IPR in the lower teeth to bring them back behind the upper teeth. One more reason could be there's a tooth-size discrepancy between the upper and the lower teeth, and it doesn't quite fit right. Next tip is cleaning your aligners. Most of the time, a toothbrush and water just on the inside surface of the aligner should be enough, and whenever you brush your teeth, just brush your aligner as well. You can use certain types of either aligner tablets or cleaners or denture cleaners, but the good news is that you're switching these out weekly. Even if you get to the point where your aligner starts to get a little dirty or discolored, you're moving to the next aligner soon. So don't worry about it too much. Also, if you're going to be in an aligner for a long period of time, you could request that your orthodontist uses what's called an ultrasonic machine to deep clean the aligner, and they are usually able to do that for you upon request. Next, here's what to do if you lose an aligner. The issue is that if you're not in something, your teeth will actually go back to their original positions and you're starting over. So if they said it's going to take 18 months and you go a period of 6 to 10 weeks without an aligner in your mouth, you actually might be resetting that time clock and when you finally get around to doing the aligners again. If you miss a night here or there, or you miss a day, it's probably not the end of the world, but long periods of time is when you get into trouble. So if you lose an aligner, go to the next one or go to the previous one. Just go into something. If you don't have an next aligner, you can always call your orthodontist and they can order a replacement aligner for you to get you into something as soon as possible. I also recommend to my patients to save all their previous aligners. Not only now do you have a backup set where you can go to the previous set if you lose an aligner, but also if your teeth start getting off track or not tracking super well, we can back up to a certain aligner and just slow up the process a little bit to get you back on track without having to order a bunch of new aligners for you. The next thing you need to know about Invisalign are something called refinements. And so if you look at the box that you're given, you'll see there's a certain number of trays and you automatically think, oh man, I only have 17 trays. You're like, well, that should just take 17 weeks, but my orthodontist told me this would take 18 to 24. That's because they have accounted for these things called refinements. And so when you're done with those initial trays you have, we actually plan to scan your mouth and make things more perfect. So we end up ordering more aligners for you. Sometimes it takes 2 refinements, sometimes it's 4 to 5 refinements. So when you do refinements, it may take a few weeks to get your aligners in. And so you do need to keep your teeth in the current position. So remember, we can't go without anything. They go back to the original positions. So wear your current aligner until we see you next. I personally tell my patients they can kind of use it as a retainer. Just wear it at night. Then they don't have to wear it full time for the weeks that we're waiting. A lot of people ask if speech is affected with your Invisalign. Maybe for the first few days, it might take an adjustment period, but as long as you're practicing out loud and you're talking, it usually gets better. Some people talk perfectly normal right away. If you're like me, it took me a couple days. That's the beauty about Invisalign, is that if you do have a big speech coming up or you have something coming up that's important, you can just slip them out, give your speech without the aligners, and then slip them back in. But if your whole job is on the phone all day long, in order for you to get the results that you're looking for, find a way to learn how to speak with these in there. That just takes practice. Lastly, if you lose or break your aligners or you're struggling with compliance, be honest with your orthodontist. I mean, sometimes life just happens and it's hard. And we're not here to shame you. We're not here to make you feel bad. I just want to get you the result you're looking for. You being honest with me and me being honest with you is the best thing we can do. My goal is to help you out.
I hope you found this video helpful. Thanks for watching and good luck on your journey with Invisalign.